In the future, we face a number of challenges in workforce planning in health and social care. But what are they?
I think the obvious big challenge, it's the economy, stupid. It's the clear indications that funding for National Health Service and for social care is going to be very tight in the foreseeable future. Clearly the other big one is demography, and in terms of how that is going to place additional demands on healthcare and health services. Ageing population particularly leading to more comorbidities and multiple morbidities and more care required in the community.
So what is the CfWI doing to face these challenges?
Horizon scanning is about long-term strategic thinking and planning in order to better meet those needs and have better evidence-based decision making. One of the reasons why horizon scanning becomes ever more important is atomization of the system and localization means that somebody has to have an overview of where things are going.
Over the past year, the CfWI has been working with our horizon scanning partners at the University of Manchester to develop our new horizon scanning portal. The portal is easy to use and will allow users to identify potential future issues which may affect their workforce as identified by their peers. The information will be categorized on the system so that it is easily searchable. The CfWI will continue to develop this portal over the next year. The CfWI has also worked to develop its 5-step horizon scanning methodology and its workforce planning framework over the past year. We have applied this approach to work that has been completed for the medical and dental student intakes project and towards supporting the nursing and midwifery program. Next year, we will continue to use this approach to underpin our workforce modelling work. So who do CfWI work with?
Good evening and welcome.
The CfWI has worked with a variety of institutions over the past year to develop our horizon scanning program. We are continuing to identify other partners to add to our existing team. The health and social care system is changing rapidly, with new organisations set to emerge in 2013. Here is what the new system will look like. So, what do our stakeholders think of our approach?
Well, I think for me, I've been in the NHS or working with the NHS now for nearly 30 years, and it's the first time I'm seeing a real concerted attempt to try and understand all the different influences that are going to impact on healthcare, and then to make sure that we get the workforce we need for the future, rather than trying to organise ourselves around the services and the workforce we currently have.
I think the real benefit of the horizon scanning approach is that it's inclusive. It gets people in the room and thinking about the future in a very structured way, but not one that's too constraining. So there's the ability to think broadly, but also move forward and identify common areas of interest.
What stood out for me personally was the thoughts and concepts, really, of kind of thinking out of your box and just changing your thought processes, really, for how your workforce should develop. I think there was a lot of questions answered out there that some of my colleagues would find really hard to deal with.
So how can the CfWI help you in the future?
So we've devised a programme which we will launch in the autumn this year, where all our systems will go up on a hub and a portal that anyone can access, and we will solicit from people things to input. And when they input, what we're hoping is that we'll be able to build very quickly an enormous, rich resource for the rest of the country to use.
If you would like to get involved in our horizon scanning work, please contact us at horizonscanning@cfwi.org.uk.